My talk is called Red Kool-Aid, Blue Kool-Aid, and I thought you sort of heard why it's called that when we started. And I will explain later as we go along why it's called that. This is the position that most Americans, the view most Americans have of the healthcare reform bill, is that Democrats forced it down the throats of the Republicans. And I think that's pretty much true. I think that's how it went, and I'm going to explain why it went that way. I'm going to talk about is Washington, D.C. really the best place to discuss healthcare reform, and here we are. I'm going to talk about the American healthcare system. We've heard some talk about that already this morning. I'm going to try to tell you some truth about how the healthcare bill came about as it did, and I'm going to tell you why the ivory tower where some of us work, and me in particular, has nothing to do with what's going on here. And I want to tell you what I think healthcare reform is, what I think the law means, and I'm then going to do the one thing that neither of our speakers did so far, make some suggestions on how we can improve things, how we can make it better. Okay, so the first thing, my goal is, I've learned a long time ago, people may not remember what you did or said, but they will always remember how you made them feel. Now, in this group, I probably don't have to encourage you to feel frustrated, surprised, angry, or motivated, but I'm going to try to get you to all of the above. When you walk out of here, hopefully, after I finish speaking, you will not be happy with me, and you will not be happy with the system in which you work. Sounds like you're already halfway there, but that's okay. So why is Washington, D.C. the center of the healthcare universe? The total healthcare expenditures a couple of years ago was about $2.5 trillion. It's 17.6% of the gross domestic product. Medicare spending is $502 billion, Medicaid $374, private insurance even more, $801. Now, given the fact that a huge chunk of that is the government spending it, how can you even begin to talk about a medical marketplace? As I alluded to in my question, there is no medical marketplace. The people who say there are delusional. If there is a medical marketplace, it sure as hell isn't between patients and doctors. That's for sure, and that's what it ought to be, because most of the marketplaces that you and I deal with are between us as consumers and somebody selling us something. And in this case, you're the providers. So what are some critical facts? We spend more per capita in the United States than any other country except East Timor, if you care. Our life expectancy ranks about 42nd. We're actually behind Cuba. There are 15 million Americans who have no access to health insurance. It's about a sixth of the population. It's a huge chunk of people. In my state, Texas, it's even greater, 25% or more in Texas. And we are the only westernized democracy without universal health care. So while the previous speakers seemed to argue for the fact that you were all about to be slaves, your colleagues in every other westernized country somehow are getting this done. So we need to keep that in mind. And this is the most influential book in my thinking. It's by T.R. Reid, who is not a physician, he's a journalist. He wrote the book called The Healing of America, and it says basically the United States does not have one healthcare system, it has four. And from his book, I extracted this. There are four basic systems of healthcare in the world. The first is the Bismarck system with private providers and payers, but the insurance is non-profit. And that's what goes on in Germany, France, Japan, and Switzerland. Then there's the Bivens system, which is a true socialized medical system and what they have in Great Britain. Then there's the national health insurance, which is what they have in Canada. Despite what people tell you, docs in Canada are in private practice. They are paid not by the federal government, by the provinces. But it does come from the provinces. And then, of course, there's a self-pay, which is no insurance at all. So how does that work in the United States? If you are a worker with employer-provided insurance, you're in Germany. If you happen to be an American Indian, a veteran, or in the military, you're in Great Britain. If you're on Medicare, you're in Canada. And if you're uninsured, you're in sub-Saharan Africa with emergency rooms. That is our healthcare system if we have one. And I don't think that's a real system. So the basic premise of T.R. Reid's book is that we can learn some comparative policy analysis, and he dedicates this healthcare book to Dwight Eisenhower, which seems absolutely preposterous. How could a healthcare book? He had nothing to do with healthcare. That's true. but he did create the interstate highway system. And why did he create the interstate highway system? Because when his tanks were rolling into Germany, he saw the autobahn and he said, I want one of those. And when he became president, he got one. The point is that despite what everybody in this town says, we can learn from other countries. American exceptionalism is silly. We can learn from other countries just as they have learned from us. God knows the Chinese have learned from us. So if that's the case, why don't we learn from the other healthcare systems and borrow what we need? The key lesson that this is from my friend on the Republican side, the key lesson I took from these countries is that the fundamental change would be easier to implement than our timid politicians believe. We can do this. We just haven't, we have decided not to. Now, here's part of the problem. What he noted was, in 1994, 3 major countries were dealing with healthcare reform: Taiwan, Switzerland, and the United States of America. 2 of those countries got it done. I needed not tell you the one with Hillary Care that didn't get it done. At those times, the public demand for universal health care was high. The majority party was being challenged by a minority party that wanted health care reform, and sustained economic growth was in place. None of those things exist now in the United States, and if anything, things are worse now, or worse in 2009 when the health care reform debate began, than they were in 1994. Yet, somehow, we got a health care reform bill. So, as you asked the question, whoever asked this question, you read my slides ahead of me. What are we willing to tolerate as a country? Across the bottom of this slide is Martin Luther King, Gloria Steinem, Harvey Milk, and Anise Parker. Anise Parker, for those of you who don't know, is the first openly gay woman mayor of a major city, and that's Houston, Texas, where I live. All of those minorities were discriminated against at one point, and at some point, the government walked in and said, you can't do that. You don't have a right to do that. These folks have rights. The question is health care a right? That question never got debated in the entire health care reform debate, and certainly not in the 9 months I spent on Capitol Hill. Never did anybody talk about that as the basis of the legislation. Is it like the police, the fire department, and the right to vote, which is what I said when I asked the question, or is it like pork bellies, wheat futures, and toilet paper? Is healthcare a commodity? And when are we going to have that discussion as a country? Because we haven't had it yet. We've implemented a law based not on philosophy at all, and I'll show you what it is. Why does healthcare feel like getting your BMW repaired? I don't know how many of you guys have BMWs and girls, but I do. It's a weakness, I understand. But it costs a small fortune to get it fixed. And no matter what they tell you, it's going to cost you more each time you go in, and they make more money the more they do. It's just like healthcare. If you guys get it right, if we get it right the first time, it's expensive. If we get it wrong, we can charge again. It doesn't matter if we got it right. And the more we do, the more we get paid. That's a nutty system. I mean, maybe it's nutty for cars, but it's just cars. So when I was 60 years old, I went to Washington, D.C. And I learned some basic truths about our government from Marie Michnick, who is the director of the Robert Wood Johnson Foundation Health Policy Fellowship. And I'm going to teach you what you taught me. Congress was never there to make good laws. It was there to prevent the making of bad laws. Now, this shows that it doesn't always work, but the one on the right, the Constitution of the United States, is pretty good. It's pretty good. And politicians never compromise their honesty. And you're all going to say, oh, they lie all the time. No, they don't. They never lie. Very rarely. And I put the leaders of the Sunday talk shows in the middle between George Washington and Abraham Lincoln. They don't lie. So when they get asked a question they don't want to answer, they answer another question. but they don't lie. Especially if you don't lie, you don't have to remember what you said. So, and the third thing she taught us is never get between a big dog and a fire hydrant. These guys are major players. They're like feudal warlords, particularly the senators. They forget who's paying them. You are. They were supposed to work for you, not the other way around. And the first thing a member of Congress does every morning is read his own local newspaper. I work for Senator Michael Enzi. He is one of the senators from Wyoming. I am from Texas. I don't believe Senator Enzi has any aspirations to run for president. In other words, I'll never be able to vote for him. What I think about his politics is really not all that important. And certainly for a member of the House, for a relatively smaller district, those are the folks that person has to please. And that's where her focus is. Let's talk a little bit about the budget. This is from Alan Schick, who's a master of the federal budget, has written this book about it. When the president and our Congress are from different parties, everyone behaves better. It's not working so well right now, but for the most part, that's true. If you think about Ronald Reagan and Tip O'Neill, Bill Clinton and Newt Gingrich, they did have a working relationship which President Obama and Speaker Boehner do not seem to have right now. And there's a reason why that is. And that's number two. In the House, the majority wins if it stays together. Speaker Boehner has a problem. He has 87 people who are members of the Tea Party who were elected by constituents and sent to Washington to be disruptive. Politics can't work if people are willing to commit political suicide just to do that. And that's pretty much what the Tea Party folks are doing. And that's why it's very difficult for Speaker Boehner to have his majority move. Now, even if he could, we've got the Senate problem. There was a time, as you heard earlier, where 51 senators could pass stuff. Now, one senator can block any legislation by having a filibuster, and it takes 60 votes to invoke what's called cloture, C-L-O-T-U-R-E, to overcome the filibuster. Now, the last point is the Congressional Budget Office. You heard a little bit about that. What the Congressional Budget Office does is score legislation. What that means is, what's the financial impact of what we're legislating? Let me tell you something. It's a very educated guess. When it came to Medicare, they were off by a factor of 10. And look how, and as you heard today, they only have a 10-year window. So at 20 years, and we're now what? Medicare almost 50. The impact is incalculable. You can't know what's going to happen. So, and lastly, authorization does not necessarily equal appropriation. So when Congress writes a law that this is supposed to happen, there is then an appropriation process which gives the money to make it happen. There's a lot of stuff in the healthcare bill that isn't quite yet paid for. Not likely that the House will pass anything above and beyond what's already passed, because now the House is Republican. And as you all know, in the Constitution, bills can originate in either house of the Congress except when it comes to spending. When it comes to spending, it must originate in the House. So there are going to be things that are authorized that are not appropriated, and the Class Act was a wonderful example where the federal government passed that, and the reason it got passed is it was a prized piece of Teddy Kennedy's legacy. That's why the Class Act, that's what the first speaker didn't tell you. It was all Kennedy. And then he's dead, and now they can't figure out how to pay for it, so it's gone. So regular order is how a bill is passed. And I don't know if anybody remember this from high school, but a bill can originate in the Senate or the House except for the revenue bills. The bills then go to committees and get discussed. That's what's called the markup. That's when amendments are put on. And eventually the committee reports out a bill. That goes to the floor of the House or the Senate. It gets passed. It is very unusual for those bills to be the same in both houses of Congress. A bill cannot go to the president's desk for signature unless it is the same. That's when there's a conference. So the leaders of the Democrats and Republicans and the leaders of the House and the Senate appoint members for the conference committee from both bodies and both parties to work out the differences. You then get a new version of the bill and it goes to the president for signature. So I'm asked this incredibly learned group, did regular order prevail when the health care bill was passed? No. What happened? Very good. I'll get to that in a second. You're a couple slides ahead of me. It's hard. That's the first thing. Senator McConnell's, I was sitting in the back of the Senate one day with Senator McConnell's chief health staffer, and I said, why does this have to be so hard? This is in the middle of the discussion. She said, it's supposed to be. It is supposed to be very hard to change the United States government. That's the way the founders built it. They built it to resist change. So I'm going to skip this part and get to this. This is the single most important piece of information I gained in a year in Washington. The 4 P's of government: policy, process, politics, and personality, in ascending order of importance. Name the 2 people whose absence most affected the health care reform debate. Kennedy. He was sick and he was gone. He was the major liberal force, but he was also the major health care force. The major legislation was being carved up in his office, and he was gone. Who was the second? What happened to the initial Obama appointment for HHS? Who was it? Tom Daschle. What happened? Didn't pay his taxes. He was gone. New York Times excoriated him, and he was gone. Those are 2 extremely powerful, well-regarded members of the. Tom Daschle was the only man, as far as I know, who was both majority and minority leader of the Senate twice. And Teddy Kennedy was in the Senate for 48 years. If those 2 guys had been in play, they would have gone down to this guy's office, Orrin Hatch, and Orrin would have picked up his guitar, and they would have sung Irish drinking songs, and we would have had a bill, probably a year before we had one, because that's how things are done on Capitol Hill, and my guess is that's probably how things are done in your life. And the most important things you've ever accomplished have been accomplished through relationships with other human beings, whether that's your marriage, or your kids, or your business partners, whatever it is. Without that, this process doesn't work. Like it or not, that's the process. And we didn't have players of all-star caliber in the process. So we didn't get an all-star bill. This is my peon to my now eliminated Duke Blue Devils from the NCAA. But the reason I show this is because the devil is in the details when it comes to healthcare reform. And Norm Ornstein, who some of you may know as a major pundit here in this city, said one day in November in a talk I heard him give, everyone's definition of healthcare reform is the same. I pay less. Folks, healthcare reform was, is, and will never be about healthcare. It's about money. The deals that were cut around the healthcare bill were business deals, and we weren't at the table. That is, the physicians. We got screwed in this deal, as if you didn't already know that. The bottom line of healthcare reform are 3 things: access, cost, and quality. Access, who gets healthcare; cost, who pays for it; and quality, how good is it? For you guys, you're learned consumers. How many of you have good doctors? Raise your hands. Okay, you do? How do you know? So, would you agree that you know more about your cell phone than you know about your doctor? No? But the young people in the audience probably do. Yeah. If you're under 30, you clearly know more about your cell phone than you know about your doctor. We don't really have a clue, most of us. And I felt it full force when I needed emergency bypass surgery. And I had to find a surgeon in Houston, Texas. Well, there's No shortage of heart surgeons in Houston, Texas, of course, but which one do you pick and how do you know? I called my friend. Now, fortunately, I have friends who actually know, I think. There's no Consumer Reports on it. And that's a problem that we've been willing to tolerate. In fact, we've promoted it. You can't, what you heard today, there's a different acuity for patients, so you can't measure quality. Folks, at some point, somebody who's paying us is going to measure whether or not we do it well. It's only a matter of time. So the other thing to remember when people talk about cost reduction is someone's salary. When you cut costs, somebody's making less money. And guess who got their costs cut in this deal? Us. So at the dawn of 2010, where was the healthcare reform process? The president had made healthcare reform one of its major legislation, despite the fact the economy went off a cliff before he got elected. Don't ask me why. It's the first time since the 1960s that a healthcare bill had even come out of a committee. What people don't realize in the Clinton healthcare bill, it never even left a congressional committee. 2 bills were reported out. November, the House version, December, the Senate version. The 2 bills were not identical, so was a regular order followed? Did they go to conference? No. Why not? That's why not. Whoever said that, that's right. The Democrats lost their 60th vote when Scott Brown was elected to replace Senator Kennedy. If this had gone to conference committee after January 19th of 2010, the Republican 41 would have stuck together, had a filibuster, nothing was going to move. At that point, most of us thought this thing is dead. How is this ever going to get through? Obamacare, no way. It's Pelosi care. Nancy Pelosi forced the Senate version of the bill more or less through the House. Then there was a small reconciliation bill at the end. But that's how the health care bill got passed. And that's why the Republicans are angry, because it didn't follow regular order and they didn't get a chance to have any input into this bill. That really annoys people on Capitol Hill. And it really annoyed my boss, who really believes in regular order. So then this thing got passed and violence erupted. Why? Why is everybody so angry? That's Michelle Bachmann. What does the Tea Party really want? I love when they say they're taking back the country. From whom? Who had it when we weren't looking? As far as I know, it's still our country, but they're taking it back. I just don't know who from. So to summarize everything, you've already heard great descriptions of the details in the bill. I'm not going to go into that. It's the first piece of major social legislation passed entirely with the votes of one party. That we know for sure. 32 to 34 million more Americans will gain access to health insurance. But that doesn't mean they'll gain access to care, as you've heard already this morning. The costs are marginally addressed in the bill. I love the editorials in New England Journal by Peter Orszag and Zeke Emanuel, who said, oh no, we're going to control costs. There's no way they're going to control costs. How are they going to control costs? It's not really in the bill. And quality, they can't even define quality. How can they measure it? They scored this, the CBO scored this as a $143 billion deficit reduction over 10 years and $1.2 trillion over 20 years. Who in this room believes you can insure 34 million more people and save money? Right. But the president said so. Didn't you hear him? You heard him, but you don't believe him. Of course you don't believe him because you're not crazy. You can't do that, right? And there are 10 titles. If you really want to go through the bill, there are a whole host of websites that are great. Believe it or not, the Democratic Party had one from the Senate side, I think, that went through the bill by title. Most of the sites go through by chronology, and your head will spin after page 3, because it's too big. But if you go through the titles, and Bill Sage, who's a professor at UT Austin, taught me this. If you go through the titles, there are 10, and the first 5 are the meat. So the first one is like private insurance. That's one where, you can't pre-existing conditions can't be, you can't be excluded from insurance. Then there's Title II is Medicare and Medicaid, and mostly Medicaid, as you heard. Title III is prevention, and that's where the controversy. And I hope some of you thought about when you heard about this contraception controversy, that this controversy would be non-existent if we didn't have employer-based health care, right? Because the whole argument is about who pays for it. Well, if it were your independent decision, like your cell phone or your television or your car, you could decide what you were buying, and you can get the car with the air conditioning or without the condoms. It doesn't matter, right? But that's not what happened. Okay, so here's the problem. I have President Obama all dressed up like a doctor. If Governor Romney wants to try to convince you that Obamacare and Romneycare are different, fine, but he's full of hop. They're exactly the same. There are subsidies, there are exchanges, and there are mandates. Those are the major three issues at stake when it comes to health care reform. The fee-for-service system is unchanged, so it's just like getting your damn BMW fixed. The more the doctor does, the more he'll get paid. Nothing has changed. If you want to change healthcare delivery, you are going to have to change the way we get paid. You're going to have to change reimbursement. This bill does not change practice, delivery, reimbursement, teaching, workforce control, remuneration, or measures of quality. That's healthcare reform? I don't think so. So while on the whole, this bill does some good things, and I think that's the way the vote went in the beginning, for the most part, this bill was supposed to be the first step. If we can't make the first step in an uncontroversial way, it's not likely we're going to make the second or third. That's not going to happen. As long as doctors and hospitals work on a fee-for-service basis, they're sort of the last of the guild system, with variable pricing for the same activity. In France, when you break your leg, it's $50 or 20 euros or whatever the heck it is, and that's it. Doesn't matter how the doctor's getting paid, that's the price. In the United States, you break your leg, a negotiation starts. That simple negotiation hasn't already occurred between the insurance company and the provider. What is that? That makes no sense. It's the same work. Okay? Using nonprofit intermediaries that negate true market forces. The previous speaker talked about market forces. Market forces, phooey. There are no market forces, no market. There's not a market between you, the provider, and your patients. The market is between employers who are buying insurance and insurance companies who are selling it. And what the patients need and what the doctors need are largely ignored. So until we do this stuff, costs aren't going to be controlled. And until costs are controlled, there is no bending of the cost curve. That's a bunch of hooey also. That's not going to happen. Okay, so one of the quotes I like to quote is from Woody Allen. Zellick, you are a great inspiration to the young of the nation who will one day grow up to be great doctors and great patients. Because my argument is we need to get better patients. The patients need to demand more from the system, not from us. As a previous speaker said, I think we do just fine. I don't think there's anything wrong with American doctors, except we need more of them, but there's nothing wrong with them. They also, by the way, I think we need to start doing doctor work and not nurse work, paperwork, secretary work, all that other financial work. We need to get back to being what we went to medical school for.